Welcome to this episode of MoveMint Medicine podcast. Thank you to those who have joined us for previous episodes. Please continue to share with your family, friends and colleagues. We want to try and get this spread far and wide. We thank our partners, says the Fit India movement, the Back to Fitness Clinic, which is the clinic that Rajat runs, La Ultra The High, which is the race that Rajat puts together in Ladakh, and Moving Mountains Within Film, which is the film about the 10th edition of La Ultra The High. So I'll hand over to Rajat, who will introduce today's guest.
Thank you, Darren, and thank you everyone for carrying on watching MoveMint Medicine podcast. And today we have a special guest, Dr. Anjali Kumar. Thank you, ma'am, for coming on board. And would you please just share your academic and professional background, please?
Okay, so I'm Dr. Anjali Kumar, and I'm a gynecologist and obstetrician, and I'm a graduate of Lady Hardinge Medical College. I did my post-graduation also from the same college. And now I head the Department of Gynecology and Obstetrics at Artemis Hospital, Gurgaon. Plus also I have my own clinic at Gurgaon. And I'm a gynae endoscopic surgeon and a specialist in high-risk pregnancy diseases. And other than that, other than my academic qualification, there's another qualification which I'm actually very proud of, that I'm a certified yoga trainer. I'm an internationally certified yoga teacher. So I'm very proud of that. And this is something which has given me a lot in life other than my medicine.
That's absolutely fantastic to hear about your professional background, but also that you've got a complementary sort of other background as well in yoga is absolutely fantastic. So have you always been involved in yoga, or is it something that you've only taken up sort of in your adulthood? Did you do yoga in your childhood?
No, you'll be damn surprised to know that I got into fitness when I was 45 years of age. I mean, this is 10 years back. I'm now 55. And before that, I was like a normal person, a normal doctor who goes to the hospital, comes back in the evening. You're reasonably active. I used to walk. I used to be fond of walking. I used to be fond of trekking. But there was nothing like a set regime which I used to follow. And fortunately, I was not overweight and I was not, suffering from any chronic diseases like diabetes or hypertension. So the life was good and I was just carrying on, thinking that I don't need anything. And one fine day, I developed bad backache and sciatica, which sort of really shook me up. And I was not wondering, nobody was able to give me the answer. That was the worst part of it. All kind of investigations were done. I went to the best of the doctors. And the only thing which came up on the MRI was a small, old, shriveled disc somewhere. And, people said that since you're not getting all right, let's operate. And I was wondering, oh God, within 2 years, I'm on the verge of getting a surgery done. So that's when, someone introduced me to yoga. And yoga really helped me. And, my back pain became better. That's when I decided to become a teacher. I went for a certification program. But as luck would have had it, I had another injury in my knee. So I had a meniscal tear. We were managing the things, by conservative measures and all, but I was not getting all right. And one fine day, the orthopedic surgeon in my hospital itself said, ma'am, you need a arthroscopic meniscectomy. So trusting the doctor, I said, okay, let's do it. I can't carry on like that. But unfortunately, after the surgery, my pain became so bad. And that's when I met Dr. Rajat, and I've been working on my knee. And now so much so that it's become part of my life and I'm able to manage most of the things. But the good part is all this introduced me to something which has given me a lot in my life other than just being a fit body. At my age, I don't suffer from any kind of chronic diseases. I'm happy. I'm, doing most of my work. Doctors have a very rigid schedule, very tiring schedule. You need to be standing in the OT for 3 hours, 4 hours. So I'm able to manage pretty much everything. And I do strength training 3 times a week. And I do my yoga 6 days a week, sometimes even twice a day. So now that with lockdown, I'm very happy doing, my practice twice a day. And this is something which I always tell all my patients and everyone, is that exercise needs to be a very happy and a sustainable exercise. If you dread going to gym in the morning, probably that's not the right kind of an exercise. You need to find out something which gives you a happy feeling to it. It could be simply dancing, it could be swimming, it could be playing a game of the tennis, it could be yoga, it could be, or maybe even a gymming. So you need to find an exercise which is happy and which is sustainable long term for you. And like I said, yoga worked for me, so I'm sure, people are able to find out what's their happy exercise calling.
Brilliant, ma'am. Most people by the age of say 30, 35 are already thinking that they're very old. And you picked up fitness at 45, and here you are. So has your practice changed? As in, like say when you were say 40, 42 or so, or even younger, has your practice changed courtesy your own journey? Like, do you say different things or do you suggest different things?
Absolutely. Dr. Rajat, you would realize the more senior you become, you realize our patients don't need us as much as we think to be, Of course, it's our responsibility to be educating them, but in terms of medications, in terms of surgeries, definitely, we need to be very, very careful. I'm one of the doctors. My prescriptions are actually the smallest. I don't write anything on the prescription. I spend 15 minutes, 20 minutes talking to every patient as to, what all should you do so that you don't need a doctor like me or any doctor for that matter. And, like you said, in my practice, especially in gynecology, I don't know whether you're aware, nowadays all gynecologists are actually facing an epidemic, which is known as PCOD, so much so 1 in 10 women is suffering from PCOD. Now that's a very high number. 20 years back, nobody suffered from something like this. And we have now clear evidence which says that PCOD is a lifestyle disease. And, so we need to be finding a solution to this disease by the modification of a lifestyle only. It really hurts me when, a young girl comes to me, 18 years of age, she's taking oral contraceptive pills, somebody advised her to take a metformin, and she doesn't know for how long, which is very sad. How can you tell a girl who's just 18 years old to keep taking metformin for, throughout her life? That's not fair. We are not doing the right kind of a job. So, I really feel as doctors, a young girl going from a gynecologist, let's say to a physician, to an endocrinologist or a dermatologist, nobody is ready to spend that much of time with that young girl to tell her what is it which caused the PCOD. What is insulin resistance? I'm sure many of the doctors themselves also would not be able to answer this question. What causes insulin resistance? When I've done big research on this, so I can speak on and on about insulin resistance. But it's really time for us to introspect. Our responsibility does not end at just writing a pill or maybe whatever, We should have a bigger role to play. Yeah, interesting, Nowadays we are talking about fetal origin of adult disease. That's a new concept, What a pregnant mother eats during her pregnancy, how physically active she is, it's going to have a bearing on the medical history of the child in the adult life. It's said in case the mother is obese and she's taking a high calorie rich diet, she's not exercising, probably this child is likely to be obese in adult life. So, we're getting a lot of evidence which says that we need to be managing our pregnancy also now in a different ways. Gone are the days when we used to tell a mother to be just sitting at one place, eating a lot, hogging so much. That's not the right way to look at pregnancy also.
So, Mom, when all of these doctors are prescribing these various treatments for a lot of these diseases that are lifestyle related, is it just because they're ignorant about the benefits of a good diet and exercise and that they're not taught during their MBBS degree? Or is it that they're just, they just don't have the sort of the skills and knowledge that are required to prescribe any changes to lifestyle?
No, Darren, I don't agree to that they don't have the required skills or the knowledge. Of course, they're all capable doctors, very educated doctors. So that's not possible that they don't know this. It's a little tricky question to answer. Maybe, in the busy OPDs, we don't have time to sit with the patient, talk to the patient, really explain her what is it which causes the problem. And I really feel somehow in the medical school, we were not taught about health. We were taught about disease. We were taught about the disease, the pathogens, the pathophysiology, the medications and the surgery, but nobody spoke about health except few chapters in the PSM books. Nobody spoke about health. What is it which requires, it's the cultivation of health is not a very difficult thing, but somehow we were not too trained to think like that. And probably, we are not able to then transfer that knowledge in that particular manner to the patients because we were never trained like that. I'm very fortunate that ever since I got exposed to yoga, it's a wholesome science which talks about health in a very simple manner. They say that a human being is supposed to be healthy. We were not supposed to be diseased. It's not difficult to be healthy. While it's difficult to be diseased, that means you really messed around with yourself somewhere in your life. That's why the body is trying to tell you, look, I'm not happy. So you need to be mending that simply by good diet, by good exercise, simple stress management, good sleep, happy, positive attitude. Body actually doesn't need more than that. So that's what I believe in nowadays.
No, that's brilliant because I was taught very early on that dis-ease, D-Y-S,
Absolutely.
dysfunction. So it's actually very interesting you say that, ma'am. So how has it changed the practice in the sense like, when someone with PCOD comes or a pregnant lady comes along, what is your advice now, ma'am, versus say like, again, 10, 15 years ago, what I was pointing to?
So, I always sit with the entire family. Like, for example, in case it's a young girl, the mother is also there. Always try and involve the mother. In case it's a pregnant lady, there is mother, there's mother-in-law. I always try and explain them that you need to understand first what is it which in the first place has caused PCOD. You have a choice whether you want to be on medication throughout your life or you want to change your life. And somehow, Dr. Rajat, I always tell this to all my patients that your health is your responsibility. It's not fair that you mess around with yourself and you come to the doctor to fix it up. That's not fair. Of course, we can tell you, we can educate you, but you need to be taking the responsibility in your hand. I'm sure that goes in your practice also. If the person is not exercising and not doing anything, obviously they can't complain that I'm having pain all the time. Whatever you teach your patients, the patients need to follow. And of course, your job as a doctor and my job as a doctor is to keep emphasizing, look, this is what you need to be doing to invest in your health. And I really feel it's very, very important for us to give that 10 minutes extra, 15 minutes extra to, tell patients to take care of your health. And it has got immense rewards. It's got immense benefits.
Very much so. I think that's a really important message. So, in fact, we spoke a few episodes ago about patients taking ownership for their own body, and that actually, we're our own sort of Rolls Royce or, whatever the high level of car might be, and that, we have to work within ourselves to actually sort of, alleviate some of our own symptoms rather than relying on the medical professionals.
Of course, see, medical practice or the medical in today's modern medicine is fabulous, when it comes to treating acute problems like, acute emergencies, trauma, shock, infections, let's say, handling a COVID patient or whatever, it's great. It's great. The mortality rates now have come down, but unfortunately, the quality of life has not changed. All of us know people are living longer, but now they have bigger problems like diabetes, like hypertension, like obesity. That means somewhere, something has gone wrong. So, I mean, our medicine is great. Absolutely. We're proud to be doctors. Absolutely. But I really feel we need to be doing little more also on the education front. And of course,
Yeah, ma'am. You've got
to do all that, we need to be the, like they say, the torch bearers. We need to be the role models. We can't be preaching something which we don't practice. If a doctor is into alcohol and smoking and has got a big pot belly, obviously, nobody's going to listen to that doctor. So we need to be setting that example, right?
So, ma'am, again, just taking it on further from this, the colleagues, most of our colleagues are not active, probably single figures, right? How do we change that? When do we get it changing? Because should it be happening at college, or someone like when they're working, should there be an impact from the hospital, or MCI should jump into it? Where should the change be happening from, ma'am?
No, I really feel, the colleagues which we are talking about, like, first of all, I also feel it's only probably just the 5%. Now, this is a very, what do I say, a discouraging figure. It's only the 5% people who actually are really into some kind of a, good lifestyle change regime, or maybe fitness or whatever. And, I really feel as doctors, most of the doctors have this know-it-all attitude. I know everything. I'm a super doctor. I'm a very senior doctor. I'm the head of department. I'm this, I'm that, and whatever, And even if somebody tells them that you should be doing this, no, it doesn't happen. I know it, it's, so we need to be open to whatever is happening all around. I was discussing this with earlier also, that there is a lot in our medicine, or there's a lot in the human body which we've not been taught. We should be open to receiving that knowledge from wherever it comes. I'm sure, when we passed our MBBS, there was no talk about the nutrition. There was no talk about the pain medicine. There was no talk about the rehabilitative medicine. And it's, I find it so, I don't know what should be the right word. I've learned a lot, from my yoga teachers. And some of them are really learned teachers, really learned. They talk about the human anatomy like probably any orthopedic surgeon talks about. So we should be open to knowledge from everywhere. And so that's the attitude I really feel we need to develop. And secondly, most of the doctors think that they won't have any time. Even in gynecology, we have very unpredictable working hours, and you get a call anytime, morning, evening. There's no proper set regime. But I have realized that, if you set your mind to doing something, you need to stick to it. I've seen many times, even in doctors also, let's say somebody's struggling with a weight issue, 2-3 months, they don't lose weight. And, they always tend to lose it. So I always tell my patients and others also, it's a long process. You need to learn to invest in your body like a SIP. The rewards are slow to come, but they're sure to come.
So what would 3 or 4 misconceptions be in your field? So when you see patients coming into your clinic, what type of sort of myths are they sort of presenting to you with?
So I really feel, especially in my practice, the conception, the concepts about health in people are generally lacking. Now, I'll give you a simple example. A girl comes to me in my OPD. She has PCOD, and she's weighing 90 kgs. A young girl who's probably just 17 or 18 years old. The mother tells me, my daughter's little healthy. So my answer to them is, look, she is not healthy. She's totally unhealthy. So they feel that being little plump is, so their concepts about health are not really right. And probably through ages, nobody sort of spoke to them. Also, I really feel these days, because of the advertising and because of a lot of things, wrong things being sold to people. For example, everybody thinks that having a packaged glass of juice or maybe having a Kellogg's is a very good idea. Vis-a-vis our roti, dal and sabji. So I always tell patients that anything which comes in a packet is helping someone who's selling it. Obviously not you. So it's a very simple thing. A diet, and people have got a lot of misconceptions about diet. A good diet need not to be an expensive diet, an exotic diet, or a fancy diet. Rather, the simpler the diet is, the lesser we mess around with the food, the lesser it is likely to mess around with us. So, that's what I keep telling my patients is that stick to whatever, is made at home. Please don't buy anything from the, market or shelves or anything that especially comes in a packet. So we've got a lot of evidences now, the plastic and the packaging and the preservatives, how they harm the body, a lot of ways, especially in women, the HPO axis, the hypothalamic pituitary axis. It's a very, very delicate, very, very sensitive axis, which can get disturbed by a lot of things, stress, worry, diet, lack of exercise. I mean, that's why 20 years back, nobody had PCOD. Nobody heard about PCOD. And today we have 1 in 8 or 1 in 10 women who are suffering from PCOD all throughout. They're coming from the urban background. I'm yet to see a poor woman coming to me with a PCOD. And that's a fact. That's a fact.
That's such a brilliant one. Ma'am, in this lockdown period, when people can't move, can't do things, what would you suggest? Because now we're even saying don't go out and walk and run. I mean, it's a total lockdown. So what should people be doing during this time?
So first of all, I look at it that way, that first of all, you should thank yourself. You've got a chutti now, which you probably never got. It's a guilt-free holiday. But you must use this time to do something which you always wanted to do and you would never found the time to do. It could be, maybe learning a guitar or singing or doing something on the computer. It could be anything. You must thank God for giving you this time that, you've got this time. Coming to the fitness especially, I think anybody who's into fitness will not be able to sit idle at home. Like I said, these days I practice twice a day and it gives me so much of happiness that I'm able to do that. And somebody who's not into fitness or who's struggling with it, they should look at it as an opportunity to do something, which probably they were deferring because of lack of time or paucity of whatever reason. What all you can do, I think, first of all, be very active at home, do whatever regular activities you can do at home, whatever routines you can do on a mat using your body weight. You can do. I mean, yoga is one of them. There are a lot of other things. You can do push-ups, you can do squats, you can do planks, you can use smaller weights, you can do bands. A lot of things can be done. You can do dancing in case you like to do dancing. It could be playing with your child inside the home. It could be anything. So I really feel we should not make too much of an issue about it. Oh, we're not able to exercise. Anybody who wants to do it will find ways how to do it.
Absolutely fantastic, Mum. Well, thank you so much for joining us today. It's been a fantastic episode. There's a lot that we can all take from this.
Yeah, thank you, Darren, and thank you, Dr. Rajat, for inviting me over. It was very pleasant.
Thank you, ma'am.
As well.
Thank you.
Thank you.
Okay, so we'll bring this episode of MoveMint Medicine to a close. Thank you to everyone that's listening, and we'll bring you in the next episode very soon.